Hello, and welcome back to the Transform Wellness Clinic. I'm Dr. Bradford Perkins, and today I'm going to talk about Thyroid Lab interpretation. So what does the thyroid do? It regulates our metabolism, it controls our body temperature, it's important in reproductive health, supports protein synthesis, and it helps with just normal growth and development. So, here's how the thyroid works. It's a feedback loop. So our hypothalamus makes something called thyrotropin releasing hormone, which goes to the anterior pituitary gland, which produces thyroid stimulating hormone. Now that's the lab we normally see when we get our thyroid checked. That is not enough, and I'm going to explain why. And then our thyroid gland produces mostly T4, some T3. Then the T4 goes out to our organs, namely our liver and kidneys, to be converted to T3, and eventually then goes to all our target organs. So I'm looking at thyroid, I'm not just ordering a TSH. It can be thrown off by biotin supplements, and it's just not as accurate. I look at a free T4 hormone, a free T3 hormone, and thyroid antibodies, which are TPO and thyroglobulin antibodies. A reverse T3 can be ordered. It's not something I routinely check. That is an option. Then you can look at T3 to reverse T3 ratios and T4 to T3 ratios. I don't go into that personally, but those are different options. So the thyroid stimulating hormone is made in the anterior pituitary, and the optimal range is somewhere between 0.5 to 2.0. So your doctor may say your thyroid's normal and your TSH is 3. That's truthfully not optimal. It is in the normal range, but not optimal range, and some people do have symptoms. Free T4, that's our storage hormone. It's made in the thyroid gland, and then it is converted into free T3 or reverse T3, depending on what's going on in the body. Optimal levels are somewhere between 1.0 to 1.5. Then free T3 is the active hormone. This is really important to have checked. Only about 20% of this is made in the thyroid gland. Most is converted in the body. We want to see an optimal range of 3.2 to 4.0. This is where I see a big difference in patients. The TSH may be normal, the free T4 may be normal, but for different reasons, they're not making free T3 efficiently. They might be making more reverse T3. Reverse T3 is the inactive T3 hormone. So stress, inflammation in the body, nutrient deficiencies lead our body to make reverse T3 instead of T3. Optimal level of free T3 is less than 15, and our free T3 to reverse T3 ratio, we do want to see a greater than 20. And then our thyroid antibodies. These are antibodies that attack the thyroid gland. They can cause hypo or hyperthyroidism. Most of the time, about 50% of the time, thyroid antibodies are related to gluten in the diet. And that's where we bring in dietary recommendations that help with thyroid antibodies. That's a different talk, but just giving a quick overview on that. Here's the lab patterns. So if someone has hypothyroidism, their TSH is high, and their free T4 and their free T3 are low. Hyperthyroidism is the opposite. TSH is low, and their free T4 and free T3 are high. And then, I don't have a great name for it. Some people call it the low T3 syndrome. TSH is normal to low normal. Free T4, normal to low normal, but the free T3 is low. Those people are probably still having symptoms of low thyroid. So symptoms of low thyroid are fatigue, weight gain, cold intolerance, constipation. It can be brain fog, anything that our metabolism is running slowly. Hyperthyroidism is the opposite. People get anxious, they lose weight suddenly, they feel hot all the time, they have insomnia, they just feel like they're amped up, their heart rate's high. All that's related to hyperthyroidism. Here are things that affect our thyroid gland. Low zinc, low selenium, low iodine, inflammation, high amount of stress, which is cortisol is our stress hormone. That's a whole different talk. And there are toxins like arsenic, for example. So we do need to think outside the box and think, what could be affecting the thyroid? We might want to add extra tests. So just as a recap, TSH is not adequate for screening for thyroid conditions by itself. So if you're having symptoms and the doctor checks a TSH and that's the only thing they check, that is not enough. Really looking at all those parameters we've talked about is important. Suboptimal thyroid levels are common and are usually a result of other processes in the body. So, if we're looking at a triad of hormones, I'm looking at the cortisol, your insulin, and your thyroid. So if you're having issues with cortisol and insulin, it's going to affect how your thyroid's functioning. So I also have to think about those other two hormones because they all work in a triad. Thank you for your time. If you want more tips, subscribe to my channel and then drop any questions or experiences in the comment. And I hope you have a great day.